In studio is Professor Annie Koh from the Singapore Management University. So Annie, to look at healthcare, biggest increase in spending is going to the Ministry of Health. It's a recognition that the rising cost of healthcare is a major concern for Singaporeans, isn't it?
I would say it's not just rising costs. I would say that it's also part of the demographics of our Singaporean population. We are all going to get older, and scientific research now makes us live longer. So essentially the demand for healthcare services is going to be going up, and therefore we have to have a system in place such that is sustainable. There has to be some co-payment schemes, there has to be some responsibility from the individuals, and so I think healthcare subsidies would kickstart, but at the same time we see that it has to be a sustainable budget in the future, and more of the budget may have to go into healthcare.
Okay, so in the future we'll also need to see a lot more doctors and nurses. Staffing needs will have to go up as well, and we saw that part of the budget will go into training and retraining. So this is something that we'll have to focus on very closely too.
Absolutely, and I would like to see more people look at going into a healthcare career. There could be a transfer of skills from somewhere else, and you get yourself retrained for the healthcare sector, because that's a very rewarding sector as well.
Overall, for the less well-off, do you see their concerns addressed in this budget, especially for healthcare?
I think for the overall budget in the healthcare, people would say at least now I don't have to worry about my MediShield, MediSave, and my trust system. We all qualify, but at the same time they are going, somebody's got to be paying for this.
Right.
So where's the co-payment scheme going to come in? And of course coming partly from the employers. But I think we should take personal responsibility. We have to keep ourselves healthy.
Right, it's always about health before healthcare, isn't it?
Absolutely.
In terms of future budgets, do you think we're going to see or have to get used to bigger portions of this committed to healthcare for all Singaporeans?
I do see that, and I think that essentially that's one of the advanced economies characteristic. You're going to see increasingly most advanced economies as they age, a higher proportion of the GDP goes into healthcare.